I have washed my hands and provided privacy for my patient. Good morning, my name is Janelle. I'm here to do a physical assessment head to toe with you, if that's okay.
That's fine.
Can you tell me your name and your birthday?
Amber Reed, and my birthday is 12/02/1987.
Hey, can you tell me what year we're in?
2020.
And the president?
Donald Trump.
And what brings you in today?
I just need a physical.
All right. Patient is alert and oriented, time 4 to person, place, time, and situation. Speech is clear and coherent. Going to move on to testing your strength. I'm going to have you, against resistance, I'm just going to have you turn your head to the left and to the right and back and forward and shrug your shoulders. Squeeze my hands. Push me. Pull. Your feet, I want you to push out against my hands. Push your legs out against my hands and then go back. Perfect. Strength is equal bilaterally in upper and lower extremities. Muscle strength is 3 out of 5 on a scale from 1 to 5. And is symmetrical and strong. Next, I'm going to be testing for sensation in the upper and lower extremities. Okay, Miss Reed, I'm going to touch you with something soft or something pointy, and you're going to tell me where it is and what the sensation is. Do you understand?
Yeah.
Okay, you're going to close your eyes, and here we go.
Soft.
And where is it?
Right upper arm.
And what's that?
Poke. Left upper arm. A poke. Left lower arm. Soft. Right lower arm. A poke. Right lower leg. Soft. Right upper leg. Poke. Left upper leg.
Patient sensation is symmetrical and intact bilaterally in the upper and lower extremities. Now I'm going to move on and test the patient's reflexes. I'm going to start here and okay. Perfect. Okay, just let your arm just hang and be really loose. Okay, under your knee. Nope, just let your leg hang. Perfect. And just let your leg hang. Perfect. Ankle. And then I'm going to test for the Bushinski reflex last. All DTRs, including Bushinski, are intact. When I tested the biceps, that was C5 and C6. The triceps were C7. The radiobrachialis tested cranial nerve 6. The knee jerk tested L4. The ankle jerk was S1. Now we're going to move on, and I'm going to test her station and gait. I've had the patient stand up, and now I'm going to test the gait. You walk 5 steps forward for me. And now turn around and walk back on your heels. Heels. Perfect. Now come back on your toes. And now heel to toe back. Patient's station is normal and the gait is normal tandem gait. Moving forward, I'm going to now assess the patient's head, ears, eyes, nose, and throat. I am looking and I see that there is no bruising or bumps, no contusion, no abnormal shape to the head or face. And then now I'm going to check the patient's eyes. I'm going to shine my light I'm gonna hold my pen, and you're gonna keep your head still and follow my pen. And I can see that the pupils are equal, round, and reactive, and they were accommodating. I'm looking at her face, and I see no nasal flaring. Can you open your mouth for me? Thank you. There's no cyanosis, circumoral cyanosis around the mouth. The mucous membranes are pink and moist. There's no pursed lip breathing and no tripoding on the patient. I'm looking at the chest, and I see that in the neck, and I see no accessory muscles being used for breathing. I'm going to go ahead. I don't see any jugular vein distension. I'm going to now palpate the carotid arteries one at a time. I palpated the carotid arteries. I felt no thrills. Now I'm going to get my stethoscope, and I'm going to auscultate the carotid arteries. I'm going to ask you to hold your breath while I do this. Okay. And now hold your breath one more time. There's no carotid buoy present. Now I'm going to assess the patient's chest. I am inspecting, and I see assessing for the contour and the shape of her chest. I inspected the contour and shape of the chest wall, and evaluated the patient's breathing. There's no visual abnormalities in shape. No barrel chest, no signs of scoliosis, pectus carinatum, or pectus excavatum. I visualize no shortness of breath, no intercostal retractions, and no patient tripoding. And now I'm going to go ahead and palpate the anterior and posterior lung fields. I'm going to use 6 positions on the posterior and 4 positions on the anterior. So I'm going to use the palm of my hand. I palpate no abnormal lung vibrations in either the anterior or posterior lung fields. Now I'm going to auscultate. Take a deep breath. Take some deep breaths for me. Okay, and last thing, I'm going to have you lift up your arm for me. I'm going to listen here. Lungs are clear, bilaterally A and P. No wheezes, rhonchi, or crackles noted. I'm going to move on, and I'm going to assess the cardiovascular system next. I am assessing the anterior chest wall, and I observe no heaves or no abnormal heaves over the anterior chest wall. I'm going to palpate starting here. Oh, with my fingertips. I palpated no thrills or abnormal vibrations over the valvular areas of the heart. I would auscultate cardiac sounds using my belt and diaphragm over all the valvular areas in Erb's point with the patient in both the sitting and lying positions, and if I have difficulty hearing the heart sounds due to obesity or chest and breast tissue, I would place the patient in left lateral decubitus position. I'm going to now, though, just listen with the diaphragm over the valvular areas of the heart. I hear normal S1, S2 sounds. I hear regular rate and rhythm. I hear no murmurs, gallops, or rubs, S3 or S4. Now I'm going to set for capillary refill. Here, let me hold your hands here. There is normal capillary refill lasting less than 2 seconds on both left and right hand fingers and is brisk. Now I'm going to assess for peripheral edema. I do not observe any signs on either the right or left upper extremities or lower extremities or feet. Now I'm going to move on and I'm going to palpate the pulses. Starting with the brachial, and now I'm doing the radial, the popliteal, the posterior tibial, and the dorsalis pedis were palpated and symmetrical. They were 3+ in quality bilaterally throughout. I would also have tested the femoral, but I'm not going to do that in this video today. I'm going to test the patient for warmth using the back of my hands. The upper and lower extremities are warm to touch. Now I'm going to move on to the abdominal assessment. So I'm going to have my patient lay down. And can I lift your shirt up? And I see that the abdomen is concave without any visible scarring. There's some obesity, no heaves, vibrations, or excessive active bowel movements across the abdomen. I see no bruises or prominent venous patterns or engorgement of veins around the umbilicus. Now I'm going to listen to all 4 quadrants of the abdomen. And I hear normal active bowel sounds across all 4 quadrants of the abdomen. I'm going to auscultate the aorta, the renal arteries, the iliac arteries. I would also auscultate the femoral arteries. I do not hear any bruits or abnormal blood turbulence or venous hums over the abdominal aorta, renal, iliac arteries. Now I'm going to palpate the 4 quadrants of the abdomen. I did not palpate any areas of the abdomen which are tender, distended. I have not noted any masses with palpation. And lastly, I'm going to perform percussion on the abdomen. I hear no abnormal innotation with percussion of the abdomen. This completes the assessment for this patient today. Assessment findings that this patient is a well-developed, well-nourished 32-year-old female in no acute distress. There's no abnormal findings in the head-to-toe assessment.